Hello, hello, badasses. I am super excited to be talking to you guys about how to love nursing no matter where you work as a nurse. I'm just going to try to get this because I had it all laid out and then the Zoom is slightly different. So, how to love nursing no matter where you work as a nurse. Why is this important? Really, I think the biggest thing that I want to do as a nurse entrepreneur in my coaching business is really empower nurses to recognize their own strengths, recognize their own power, to create nursing into what you want it to be. You get to create a career that you love. You get to create a career that fills you with fulfillment, and you get to love nursing and love your life and have the energy and capacity to show up for yourself, to show up for your family, your friends, your loved ones, to do things that are important to you beyond nursing in your life, in your personal life. So, this is kind of like why I get up here and I talk about all of these things, but I really just want to give you tools and resources. So, today in this training, I'm going to be teaching you a really important, vital tool that I use through my whole coaching practice. So, when you work with me as a one on one nurse burnout coach, this is a vital tool that we use throughout the whole 6 month one on one program to help you kind of reframe, change the way that you're showing up in your nursing career so that you can love it, so that you can feel fulfilled, so that you can create that nursing experience into what you want it to be. So, to kind of start with, who am I to be talking to you and what's my story? So, my name is Jana Holtzman. I am a registered nurse. I have my bachelor's degree and a nurse burnout coach. So, my story in nursing is I started nursing right out of school. I went into a float pool. So, I did med surg float for a very large hospital system. So I literally floated to multiple hospitals. There was like two main hospitals that I floated like back and forth between, and then like a few scattered hospitals outside of that. So like sometimes I would end up driving like an hour away to go to one of like the more rural hospitals that were in this hospital system. For my shift. So I did everything. I worked on all kinds of med surg floors. I worked on all kinds of, step down PCU. I did all kinds of different nursing, and it very quickly helped me realize something because so many nurses over and over came to me with the same questions, being like, what is it like to work over there? Is it better to work in this hospital versus, the hospital I'm currently in? Or is it better to work in this kind of unit or that kind of unit? And it really gave me that deep understanding that the grass is not greener in another unit. The management may be different, but you're having the same kind of experiences, you're having the same kind of problems, the same kind of things that you're dealing with. Being in that float pool was a really helpful thing because I know so many nurses are just struggling right now, and they tend to think and still ask these questions. I get them all the time of whether it would be better in a different area. And I can tell you from my personal experience that the grass is greener where you water it, not where you end up working. It's not the unit, it's not the manager, it's not the staffing ratios that makes your experience of nursing. It's you that's making your experience. And absolutely, there's better managers, there's better staffing ratios, there is better healthcare systems out there. But at the end of the day, it's up to you. And I think that is extremely important because that means that you have the power and the capacity to create it into what you want it to be versus just like accepting that it's a hand that you're dealt. So I floated, I did med surg float all in all kinds of units. After a year of that, I went into critical care float. I was like, I think critical care is where I like the critical thinking. So I did ICU, ER, PACU, I did like the cardiac ICU, everything in between the cardiac care unit. So I went to all of those units and I ended up loving the cardiac intensive care unit, and doing like post open heart surgery. So that was kind of where I ended up going full time, worked there. And then I moved to Florida. You moved to a different country from Canada to Florida. Still working in a cardiac care unit, and I still work now. I do ECMO specialty and the cardiovascular intensive care unit. So when you're like, I don't know if she gets it because she's not in it. I am in it. I work full time, and have my coaching business. So I 100% understand what the climate in healthcare is like right now because I am firsthand experiencing that. And I also understand the amount of power and capacity that we have to impact our own lives, our own careers, but as well as the unit where you're working for the better, to create changes that allow you to thrive in any environment. So that's kind of like my nursing backstory. My first experience with burnout really was in my first job doing the med surg float. I found it really difficult because you're going to so many different places. You're constantly getting the quote unquote annoying patients or the heavy patients, the patients that those floors are sick and tired of dealing with. So you're getting those patients, and kind of like often getting the like drawing the short straw because they're like, oh, they're new, they're only here for a day, it'll be fine. But when you're constantly experiencing those kind of difficult situations, it is draining and exhausting. And it left me wondering, like, if this is really what I want to do. Is this where I want to be? Is this like what I signed up for? Do I even want to do this? And I started asking those questions, and I kind of did what I feel like most people tend to do is they start looking for answers, but they're like, okay, I'm going to get a few things right first with myself. So I was like, okay, I'm going to get fit. So I hired a personal trainer, got super, probably like one of the best fitness times in my life, super fit. But the problem was I was still feeling the same way. I was still having the same experience of nursing. I was still drained. I was still exhausted. I was still left wondering all of the what ifs. Like, is this really what I meant to do? Is this where I want to be? Is this like what I want for myself? So I started, connecting with different people, and the concept of life coaching kept coming up for me. And I started listening to podcasts and consuming more and more information that really just like opened my awareness that I actually had power to do something with my life, and I could change the way I was thinking, change the way I was feeling to change my experience of that. So I still like wasn't really sure about this life coaching concept, but it kept coming up. It was listening to podcasts, I was reading books, I was consuming all this information that was created by life coaches. So I actually ended up Googling it and was like, I don't know what this is, but I'm gonna Google it. And I reached out to my first ever coach in my area. I literally Googled her, found her, reached out to her. I called her on the phone, which for me was like totally up there. I hated even like calling to make a doctor's appointment. I hated that, calling people. So I reached out to her, I started talking to her, and I was like, yep, this is it. So I worked with her for pretty much a year. And in that time, even she was a general life coach, just like whatever you're dealing with, I went to her, we worked on it, and she helped me better understand myself and got me asking questions about like who actually was I? Who was I before I added all the shoulds and like the things that I felt like I should do and how I should be and how I should act and a good nurse and all these labels? Who was I actually, and what did I want for myself? How did I want to help people? How did I want to use my nursing experience to create something that I was really proud of and could create fulfillment in that? And through that journey, I really made massive shifts. And all of my like, no, but like a good portion of my coworkers were going to be more so than when I got super fit. They were coming to me asking like, what changed? Like, you're so happy, you're so like confident, you like seem to know what's going on, like you're totally energetically different when you show up at work. And I started like offering advice and support and things that had worked for me personally. And in that process, I realized how much I loved that, to really empower nurses and give them those tools and resources to free themselves from burnout so they could love their jobs and love their lives inside and outside of the hospital. So I think that was kind of the turning moment for me. I ended up going and getting my coach training, and have been doing a few different things, but really burnout coaching ever since. So yes, that is my nursing burnout experience, which turned into kind of like the best thing in my life and creating a fulfilling nursing career. So to start with, how do you love your nursing job no matter where you work? It really is about taking accountability for the fact that we're creating our reality. We get to choose the way that we're showing up. We get to choose the way that we're thinking and feeling. And I'm going to get into how you actually do that. But if you're not being intentional about it, your brain is going to go based on its auto programming, based on the things that you learned as a child, the things that you learned from your parents, your teachers, anybody who was influential to you as a young age. You're going to use your understandings that you develop from those childhood experiences to interpret your reality. And the same is true for nursing. You're going to use your experiences that you got from your nursing instructors, your clinical instructors, your preceptors, your coworkers, that bad experience that you had in the beginning of your career. You're using those experiences to shape your reality, your experience of your nursing profession and your career. So basically, in psychology, what this is called is observation bias. And this works for all aspects of our lives, but it's basically like how your brain has been programmed to see your reality. So, how we see our world. And I underlined the our world because it's not something that is objective, it's something that's subjective. It's really important for us to realize, just like a pain rating scale on a scale of 1 to 10, when I ask you that question about anything, when I ask you that question about pain right now, if I asked you that question like after a shift on a scale of 1 to 10, like how bad is your headache, or how sore are your feet, or how drained and exhausted are you, that answer is going to be subjective to you. And it's the same, like your brain interprets things in your life based on what it feels is important to you. So, as a nurse, some examples of how this works is your brain is going to see things in your day-to-day life that it finds important to you. So, you could be at the grocery store and you're going to see somebody with like ridiculous edema in their feet, and you're like, ooh, that person has some heart failure. Or you're gonna see somebody with like the best veins. You're gonna see that like they have like the biggest, juiciest veins, and you're gonna be looking at them being like, damn, I could like throw an IV in there from across the room. Like, why can't you be my patient versus like the frail elderly person with no veins? Your brain has literally been conditioned to focus on those things. Do you think like an accountant goes into the grocery store and notices somebody's pedal edema? No, not at all. Like never in a million years would they notice that. But we as nurses have been programmed and trained and conditioned to notice these things because we need to notice them for our patients' safety and our patients' sake. But we do it all the time. We notice those things outside in the reality, in our world. So those are things that we've been conditioned to focus on that not everybody's focusing on. And the same thing is true for your experience of nursing. So why do I bring this up? I really want to hone in that your experience of your nursing career is based on the way that your brain is programmed. And the fantastic thing is, you can change the way that your brain is programmed and reprogram it to focus on different things. Focusing on somebody's edema or focusing on how juicy somebody's veins look is not something that's bad for us as nurses. It's actually a really useful skill for our nursing profession. Maybe not as much if you like work in dermatology and you never you never care about somebody's edema or their IVs. But we have been trained to focus on those things. So the problem becomes when we have trained our brains to focus on things that are not serving us, focus on things that are making us feel worse in our careers, focusing on all the ways that things aren't working. We're focusing on often like factual things, but we're making them mean things that do not allow us to feel good and create the career and the results and the sense of fulfillment that we want. So I'm going to get deeper into that in a minute. But to start with, let's see if we can pull this up. There we go. How does our brain really create that reality? So this is kind of like the precursor to the tool that I'm going to teach you so that you can better understand it and how our brains work. So your brain literally is a messenger system. So your brain thinks a thought. Now you could be thinking any thought. You could be like, I want you to take a moment and think about, a meme or a video or something that you've seen online that just like every time you see it, it just makes you happy, it makes you smile. And just like take a minute to just think about that. Think a thought, like be like, oh my god, that's so cute. Remember like that dog video where it's like he's a happy guy, and like the dog with like the floppy ears, and he's like kind of like trotting. I think of that. So I thought of that video, and I'm like, oh my god, that dog is so cute. I'm thinking that thought. When you think that thought and you experience that happy image, and I want you to then just notice what happened in your body. So your brain thought a thought, being like, oh my god, that dog is so cute. Or you maybe think about your personal life or, a kid that you love, or an animal, a pet that you like absolutely love. When you think about them, you have a thought about them, and then what happens is you have a nervous system response in your body, which is basically a sensation. So this happens every single time. You are thinking thoughts all day long, and how you know what kind of thoughts you are thinking is based on your nervous system response. Are you at work having thoughts about like how difficult it is and how much you're struggling, and you're having anxiety response? Or are you having, like frustration, anger, annoyance? You can really tell the nervous system response. But if I'm thinking about that like happy dog video, I'm like, oh my god, he's so cute. I'm thinking like, oh, I love that. Like I'm finding like that joy, that happiness, that love. Like it feels good. That nervous system. But really what's happening, your body is experiencing that sensation, but then it goes back up to your brain, and your brain interprets again that body sensation. So your brain thinks a thought, you have a nervous system response, which is literally just a sensation in your body. When you get down to it, you're like, I feel warm, I feel a tingling, I feel a tightness, I feel a squeezing, I feel, a color. Some people experience different sensations in different colors, and then once you experience that sensation, your body goes back up to your brain, and your brain interprets that sensation and labels it as an emotion. So as I was saying, I was thinking about the happy dog video. I had that warmth, I have like that like kind of like ooh, exciting, like tingly almost, and then it goes back up to my brain, and I'm like, I'm happy, I'm experiencing joy, I love that dog. And this happens over and over and over and over and over and over all day long for everything that you are doing and experiencing. It is literally a messenger system. Your body is experiencing something, your brain is interpreting it. So as you think a thought, you experience a sensation, your brain interprets it, goes back and back and back. You think more thoughts, you experience more sensations, you experience more emotions that we have labeled that sensation. This messenger system is vital for us to understand, to use the tool effectively for how we change our reality. When you are fully understanding this, it's basically like, okay, all that's happening right now, even if I'm thinking something that doesn't feel good, what my body is doing is just telling me and getting me to experience that so I can have a better understanding of what's happening up here. So sometimes it's easier for us to focus on our body, and sometimes it's easier for us to focus on our thoughts, depending on how your brain works. So wherever it's easier for you to focus on, you can kind of get that understanding of what is happening in your body, in your brain. So now we get to the actual tool. You understand what works, The tool, life coaching tool, I did not create this. This is a life coach school tool created by Brooke Castillo. Absolutely giving her the credit because it is her tool. But basically, it is a cognitive behavioral therapy approach, which means you have cognitive, you have a thinking process, you have a behavioral response to it. So it really is such a vital, useful tool for my clients. Every time I work with a client on a one-on-one process, when we partner together for nurse burnout coaching, I help them better understand the way that they're doing things now and bring it to them in a way that they can choose how they want to shift, how they want to change. Because sometimes things are really useful. Like you noticing somebody's edema is a helpful skill. But feeling frustrated, drained, and exhausted is not a helpful skill for you enjoying your career. So this tool allows my clients to create so much clarity in their personal lives and their professional lives to make empowered decisions to create their life into what they want it to be, to create that nursing job into what they want it on how they want it for themselves. So basically, this is the thing you want to write down because this is the really helpful thing. So basically, the tool is this thing. What you're going to do is you're going to write, like if you had a blank piece of paper, you're going to write down circumstances on one line, thought on the next line, feeling, action, results. When you are using this tool, I personally just do like the CTFAR. Like I just write down the C, but on one line a piece. You may want to have multiple lines, but basically you're taking your current experience and plugging it into this formula, and then you can look at it from like basically taking that step back. You can look at it and make informed decisions about whether or not you want to continue to use this tool, continue to use this thinking process, or make changes to it. So I'm going to kind of go through this. So you have the circumstances, thought, feeling, action, results. So I'm going to use the basically the unintentional experience. So how you're currently experiencing your nursing profession, your nursing job right now. Then we're going to go into like the intentional one. So like what you want to do. So you can use this model in so many different ways. I just want to give it to you in the basic form. When you start working with me as a client, we like dig deeper into it. We start with the result line to create the result that you want to get. But at the most basic, I really just want you to have this tool and start using it in its basic format so that you can start creating the results of more fulfillment, of a more enjoyable nursing career. So I'm just going to get rid of this. And I'm going to do, as I said, I'm just going to write the like CTFAR. So the circumstances that you're dealing with right now that are creating a nursing experience you don't like. So the circumstances, I'm just going to get rid of my chair because I feel like that would be easier. So, and now I've like cut myself off. So these circumstances that I'm hearing from my clients, I'm hearing from people that I'm getting on consult, like burnout triage calls with, I'm hearing from you guys in the Facebook community, I'm hearing from Instagram. These are these circumstances that I hear are like responsible for creating these thoughts. So circumstances could include anything like, these are the problems that people are having right now. So staffing ratios. Sicker and sicker patients. Like the acuity of the patients is getting worse and worse. Bad managers. What else could it be? Broken stuff. It could be like pharmacy not delivering things. So these are all circumstances. These are facts. And I think this is something that's the most important for you to realize when using this tool is the C line, the circumstances must always be facts. These are not your opinions. These are like, you could ask 100 different people to look at this situation and be like, okay, the staffing ratio is 4 patients to 1 nurse. That's a fact. The, IV pump is broken. That's a fact. The patient acuity, the patients are getting sicker. I think everybody could look at, the patients in the hospital now versus 20 years ago, and wow, there's a lot more sick patients. Then it comes to the thought line. This is where your opinions are. This is where you are giving your opinion, the thought that's coming up. When I was coming up with these, I wrote down a bunch of different ones from different clients and different experiences, and I just want you to pick the one that feels the most ugh. When you think that thought, you get the most emotional response in your body. So I kind of summarized with I can't enjoy nursing in these conditions. Some other thoughts is I am not supported here. I need a new job. It's not my responsibility to change the system. My manager is responsible for lack of communication. This is why I feel so out of control. So when you think I can't, it's impossible. I can't enjoy nursing in these conditions. The way that the system is right now, there is no way. There is no way I could enjoy it right now. How does that feel? When you think that thought, there's no way I could possibly enjoy nursing right now because of these conditions, because of the things that are happening in the healthcare system right now. How does that feel? To me, it feels frustrated. This is a thought, and a feeling I see coming up so much with my clients over and over and over. They are experiencing this sense of frustration. They're experiencing anger. And just exhaustion. If you're spending all day dealing with all these problems, and you're telling yourself I can't enjoy nursing in this condition, it just continues to perpetuate it. You're thinking the same thought over, you're experiencing the same sensation, it goes back to your brain, and over again. So when you are looking and telling yourself, there's no way I can enjoy nursing with these conditions in the profession right now, you're feeling frustrated, angry, exhausted, actions. What do? This is the behavioral component. This is okay, so you feel that way, so how do you show up? This is what I used to do, bitch, at the nurse's station. Find whoever could listen, find your nursing friends, and just talk about all the problems. You would not believe how many times I had to call pharmacy to get my med. You would not believe how difficult my patient is. You would not believe how annoying this person is. Can you believe our manager? She denied all of my vacation time. Can you believe, and you continue to, find all of the ways things aren't working. And there's nothing wrong with venting to your coworkers. I'm not going to say that, I haven't been one of those people, because I have. And I still do have those times where it's I just need to talk this out to somebody. But when you continue to relive it, when you continue to find all the ways that it's not working and continue to go back to explain that and tell that story over and over again, it does not allow you to get out of that experience. It keeps you in that experience. You continue to think the same thoughts, experience the same feelings, so you continue to stay frustrated, angry, and exhausted. And my question for you is, do you want to stay feeling frustrated, angry, and exhausted? Because if it's no, then it's about shifting, and we're going to get into how to shift it. But right now, I just really want you to kind of be aware that it is in your capacity to change the way that you are thinking, feeling, and how you're showing up. What else do? You tell stories to coworkers. You complain to manager. Um, you go home. What happens when you go home? You snap at your spouse because you're so drained and exhausted and frustrated. You snap at your kids. You're grumpy. You just don't want to deal with it. You avoid doing your household things that you want to do. You don't take the time to cook a nutritious meal so that you eat junk. How does this continue to perpetuate? You don't do your load of laundry. You're left wearing the things from the back of your closet. Like, all of these things just continue to perpetuate your experience of burnout. They continue to cycle. So the result becomes you cycle through burnout. You are drained, you're exhausted, you're frustrated, you feel, I think this is important, you are out of control of your career. Because you're not creating it into what you want for yourself. You're not creating a career that feels good to you. You're not creating a career that moves you into more of what you want. You're not feeling fulfilled in nursing because 99% of the time at work, you're feeling frustrated, angry, and exhausted. So what happens with these models is your brain replays them over and over and over again. And every time you see a circumstance, the same circumstance, every time you see, wow, 3 people called out sick, so I guess I have 2 extra patients now. Every time you see something that's broken, your brain cycles through this exact same experience over and over and over again. So you continue to prove yourself right. Your brain loves to prove itself right. So every time you have this experience, you continue to have the same thing, you prove itself right. You have that same experience, you feel those same things, you show up in the same similar ways, and you create the same burnout experience. So looking at this, and if you're watching the replay, you can put #replay and share your thoughts, your feelings of how this is showing up. But I wanted to use something that was similar, kind of generalized for the nursing experience and why this is causing this cycle of burnout for so many of us. So you can share your kind of what you're doing if you want to, or you can send it in a message to me. My whiteboard marker. So I'm going to erase this, and what I can do actually is I'll take a picture and I will post it in the comment section if you can't see it very clearly here. So now we're going to go into the oops, I didn't want to, so the circumstance is going to stay the same. The circumstances don't change. Remember, these are the facts. These are the things that anybody, 100 different people can look at the same situation and say, yep, those are facts. So the circumstances stay the same, no matter what. But what gets to change is how we are thinking, feeling, what we're doing, and what results this is creating for our lives. So if our circumstances is the exact same, what are some thoughts that we can choose to think? And this is the time where I really want I want you to personally choose things that feel true to you. And after we do this model, if you struggle to go from that feeling of there's no way I can, feel good in the circumstances of nursing right now in this climate of in healthcare, if it feels like it's too heavy and too difficult for you to go to loving your nursing, and it just feels like that toxic positivity where you're slapping a smile on your face when it doesn't feel true. I'm gonna share like something in the in between. I like to call it finding neutrality. So if you're in that true state of burnout, sometimes for different people's brains, it can be really difficult to go to that like good place immediately. So sometimes what we need to do is we need to find that neutrality, find that in between zone, to get you to that place. But like climbing a ladder, it's a step by step process. I never want you to slap that smile on your face and fake it till you make it. This is going to, that will cause a lot of separation in yourself. It'll cause a lot of like guilt and trauma that is not what we want. We want this to be your real experience and you to create sustainable lifelong results. And that's a huge component that I work with my one-on-one clients are, is when we do burnout coaching, is to give you these tools and to be able to do that step-by-step process so that you can create it for your life, create it for your career, for life. I want you to have the tools to be able to do this over and over again for the rest of your life. So, a thought that serves me so well, and it has worked for a lot of my clients, and it is no matter what, I'm capable of figuring this out. And I'm going to talk kind of about why it's so important. So no matter what, I'm capable of figuring it out. Why is this such an important thought and a really useful tool? Because it's giving you the power. It's giving you the capacity and that power to be like, I know healthcare right now is kind of a shit show. It's the burning dumpster fire, but I am capable of figuring it out. No matter what is happening in the outside world, I'm capable of figuring it out. It's really allowing you to start taking responsibility for what is in your control to create the career that you want, to make you feel like you are actually making an impact and making a difference in your patients' lives so that you can feel fulfillment in your career. No matter what, I'm capable of figuring it out. So if you could just sit for a moment and be like, no matter what, I'm capable of figuring it out. The staffing ratios could suck, stuff could be broken, the patients are sicker, pharmacy didn't deliver your meds, your manager is annoying you. But no matter what, I'm capable of figuring it out. That really just like creates such a strength. So I feel strong. I feel confident. Like it's in my power to figure this out. Because you're in control of your reality. Strong, confident, empowered, even. So when you feel strong, confident, empowered in your career, like, yeah, shit's happening, shit's going down, that's okay. Because no matter what, I'm capable of figuring it out. I feel good about this. I feel strong. I feel like you get yourself in like that power pose where you got the feet shoulder distance apart and you're like, I am capable of figuring this out. And I know it sounds ridiculous, but it works. How do you show up? You show up differently because you're ready and willing to find solutions to problems. Like, if you're like, I'm gonna figure this out so that I can enjoy my career, you're like, okay, I'm gonna find a solution to this problem. How am I gonna find the solution? I'm not sure yet, but I'm gonna start looking for the solutions. You get your work done in a timely manner, which means you have more energy at the end of the day because you feel better. You're spending less time reliving that burnout experience. So imagine if you finish your day and you're like, damn, I did figure it out. Like, look at all those examples of the times that I figured it out. You know, things happen, I figured it out. I handled that situation in such a good way. And you go home being like, damn, I really did it. I'm so proud of myself. Like, I figured it out. Like, I can feel good with what happened today at work. So how does this, so the ripple effect is you feel good in your job. You get to have the energy and the capacity because you're not wasting, I don't want to say like wasting, you're not depleting your energy, so you get to enjoy your life. Feel good in your job, enjoy life with more energy. So notice how different these two thought models are. The first one, very heavy, very emotionally exhausting and draining. And when you continue to experience it over and over at work, it just depletes every ounce of your energy and it adds to the burnout experience. Whereas this thought model, it's the exact same experience, it's the exact same circumstances, but your experience of what's happening is totally different, and the only thing that shifted was your thought. This is how you change your entire life. And for some thoughts, it literally is just bringing it into your awareness. For other thoughts, it takes work to reprogram your brain and create that reality. So I'm going to take a picture of this so I can post it in the chat or comments. And then I'm going to move to if this is too difficult for you, like if you're in that state of burnout right now and going from that exhaustion, frustration, and anger it's just too much right now for you to even like believe this thought model to be true, I'm going to give you a neutral model. So this is something that's really helpful for my clients, and this is a lot of the work that I do, is helping you build that bridge thought. So when you work with me one-on-one, we see where you are right now, we see where you want to go, and then we create those step-by-step processing. I have like a five-step client process that I walk my clients through. So by the end of the 6 months, they love their career. They really are on a path. They have that clear plan, the clarity of what they want for their careers, and are able to create it for themselves ongoing. I want you to be, empowered individuals who are totally self-sufficient. Like I want you to have the tools so that you can continue to do this work. So same thing, but this is going to be the more neutral model. This is like that stepping stone. So if the first one was where you're at now, the second one is just too far out of your reach. It doesn't feel real. Like I'm talking about it and you're kind of like, what's this lady smoking? This is probably the more easy to accept model for you. So the same circumstances, staffing ratios, sick patients, broken stuff, your manager's unresponsive to your problems, pharmacy isn't delivering your meds. Same stuff is happening in this healthcare profession. There's two thoughts that kind of came up for me. You can kind of choose the one that works best for you. But I like I am ready to figure this out. Another one that you could try is like, I can find support to figure this out. So this is another thought. I can find support to figure this out. So maybe even if that one could be really helpful for you, if you're not even ready to like fully take that like responsibility, that accountability that you can change your reality, but you can believe that you can find the support to figure it out. That's like the hugest thing. Is like if you can believe that there is the support out there and you're willing to start looking for it. I'm ready to figure this out. I'm ready to start looking for options to figure this out. Maybe I don't know what that's going to look like, but that's so much more like in between ground. Like if you can't believe no matter what I'm capable of figuring this out, maybe I'm ready to find the support to figure this out. I'm ready to start being more aware and being more open that there is alternatives for me to feel better, for me to create the career that I want. So when I think those thoughts, it feels honestly fairly neutral. And that's what we want. We want what happens when something feels like neutral or just like, okay, yeah, that makes sense. That feels good in my body. It's because your brain isn't like on a different level of belief systems where it just feels totally foreign to you. So you can feel calm when you can, you can accept that. Like, okay, that feels true for me. And when you are like in that place of acceptance and calm, and you're like, I'm ready to figure this out, maybe it even feels curious. Can you start getting curious? Oh my god, I totally just butchered that. My brain totally forgot how to spell curious. It's all good. So, what happens then? You go through the motions, but in a more calm, collected, like, okay, this is how it is. It's just like going through the motions, but like with acceptance. All right, this is how it is. This is the hand that I was dealt today at work. I'm gonna figure it. I mean, I'm ready and I'm open to there being other alternatives. So it's just taking that baby step into shifting into that next model of I'm gonna figure this out. It's like maybe there is a solution. How does that feel to you? You're like, maybe there is an alternative. Maybe there is a solution. So I can believe that it's possible for me to actually like nursing, for me to actually feel good at the end of my day, for me to actually have the energy to live my life outside of nursing. And what would that result be is you going home feeling calm. You may be going into work feeling prepared. You go into life with this sense of curiosity rather than dread, exhaustion, frustration. So, are you ready to believe that maybe it's possible for you to figure this out? And the alternative is, like, I think this is so vital for us to think about is, like, what's the alternative? The alternative is you staying in this burnout experience for the next 20 years of your career, the next 30 years, the next 10 years, however long you have in this profession. Can you accept staying exactly where you are now? What would that be like? Because for me, if I was thinking back to when I was in that burnout state, there's no way in hell. I couldn't even comprehend doing that, having that experience for years to come. So the alternative is starting to create these belief systems, starting to accept that you have the power, the capacity to create change, and doing the work to feel that. So I really would love for you, if you're watching the replay, put that hashtag replay, put in your thought models, put in your thinking process, putting in like what came up for you when you were going through this. Did anything stand out for you that was really like, wow? I know a lot of my clients really, really appreciate the neutral model, because a lot of the times, as I said, several times now, it's like you can't go from point A to point B. Your brain, it's just too much for your brain. So it's putting that ladder, putting those steps in between to allow your brain to start believing that what if it is possible? Just start asking that question, like, what if it is possible for me to start enjoying my nursing career? What if it is possible for me to finish my shift and come home and actually do things that I want to do? What if it's possible for me to build stronger quality relationships with my spouse, my friends, my husband, my kids, because I'm no longer drained and exhausted? What if it's possible for me to show up for all of those important life events and be present and fully present there with them? Like, what would that be like? What if it was possible for you to actually finish your shifts feeling fulfilled, feeling like you made an impact, you made a difference on somebody's life, and really recognizing the power and the beauty of that? This is such good work. If this is something that you really love, this is the work that I do with my clients. This is, one of the useful tools that I use with my clients, and we get to go so much deeper into it and being able to kind of reverse engineer it so that you can create the results in your career on an ongoing and a continuous basis, even long after we finish working together. So if this sounds like something that you really need and are like starting to, create that possibility for yourself, I encourage you to sign up for a consult call. This is a burnout triage call. So we're going to go over where you are right now, where you want to be in your nursing career, or like even just like what will be possible, like what could you imagine for yourself. And I'm going to tell you my process to help you get there, and we can see if it is a good fit for both of us to work together. Alternatively, I want to offer you guys another freebie. Sending you a digital copy. If you work with me as a client, I send this like in person, paper form, but this is a workbook that I created, which really, it does go over the model again in depth, different kind of tools and things that you can work through. There's different scenarios, different questions that really just help you open your brain awareness to what is possible and get you thinking in that way that allows you to start empowering yourself for what is in your control as a nurse to change, no matter what is happening in this healthcare system. And we all know it is just pure chaos. So I want to give you the tools. If you put a hashtag empowered in the comments, I will send you the digital copy of this and you can start working through that. And that is a freebie. So no cost anything. It's just so you can do some of this work a little bit deeper and start applying it to your life. All right, badasses, that is all I have for today. Thank you so much for joining. I look forward to talking to you all again soon. Feel free to send me messages with any questions you have or drop them in the comments below. Have an amazing rest of your day.